You're listening to the Business Communicators.
Thomas and Hattie, we've got some good news to share. And I think it's kind of interesting because Tuesday afternoon, and I guess just for context, I had been signing up for like every single COVID-19 wait list within the state of Texas. Wherever I can drive, that's where I'm signing up for. I got a text on last Tuesday, and it said that I was able to sign up for the COVID-19 vaccine here in Houston. I texted both of you with excitement, and both of you responded, already gotten our first dose. So, turns out, our entire podcast has at least one dose of the COVID-19 vaccine, which means
yay!
We will be recording in person very, very shortly.
Woohoo!
Woo! Yay! For all of our listeners out there, we talk about the communications, and the communications to sign up is kind of suspect at best, meaning that you got to go to half dozen different sites. Where are you willing to drive to? I found a little link that showed where all the distributions were going, so I could look at what places had the most doses of what they were.
Oh, you were doing some serious research.
He's an analytical guy. Of course he does.
I get that. That is just hilarious because it wasn't that hard. It wasn't that serious for me. I got two different emails. One from one hospital, one from Harris County. But I got the first one from the hospital. Signed up. Boom.
Yeah.
So it's interesting.
So originally I tried to, because I'm a male, middle-aged male who doesn't necessarily have a primary care doctor.
You're just
research
special.
shows. No, I'm really not. And having a degree in healthcare research, I know I should not be that way. So part of it was signing up for the different hospitals because I couldn't, because I wasn't a patient there. Signing up for the different counties because I was 1B, or even further down the list. But when I finally said, okay, I got fed up. I tried one day, couldn't find places to sign up. Click here, go there, call this number, get into the auto call circular. And so then that's when I said, okay, take a step back. Let's do this smart. Went to like 3 different things, registered 3 times. Literally within 12 hours, I had the first email saying you can register today for a dose today. While I'm standing in line, I get 2 messages from 2 other ones I signed up for, and then that afternoon or that evening I got the 4th one. So all 4 of them wound up hitting all at the same time because of that analytical mind of knowing, okay, here's where they're going to go. I didn't go to Harris County because those areas, they'd get them and they'd turn and burn them. Get them, turn and burn them. So get on the waiting list early there. But if you're willing to drive, Montgomery County had a lot as of yesterday. I think Galveston County has some. And then if you want to really go out, West Texas, for whatever reason, had a ton of them last week.
Well, same thing in East Texas as well. But for me, I was very emotional after getting the vaccine. I got the Moderna vaccine, and I thankful for the team at United Memorial Medical Center for doing the vaccine site at Del Mar Stadium here in Houston. But as I was driving up, the whole thing was really efficient. It was like 30 to 45 minutes at most, and 15 of that was actual just wait time, observation time. But everyone was so kind, so friendly, and just made the whole process easy. But I got very emotional before and after getting the shot, and it's not because I have a fear for shots. It's just because it was on the 1-year anniversary of the day that the country shut down. And for me, just to kind of reflect on what science has been able to do, hundreds of labs throughout the world being able to collaborate, communications professionals being able to deliver messages to get people vaccinated and stay safe. All that's happened in 1 year. I mean, that's incredible. You look at, there was a Nature magazine story in December of 2020, and it said that just how remarkable the vaccine progress has been. Because prior to this, the quickest vaccine development had been 4 years. And so, I don't know, it was pretty emotional. And then, of course, in true millennial fashion, had to take a selfie. So that's what it is.
I did a little jig. I went through Methodist Hospital from the time I was in the garage to where there was always somebody guiding me. It was a Methodist on Greenbrier. Shout out to Methodist. And there was always somebody, it was like they were 6 feet apart, all the way up to where I took the shot. And as I was going in, I didn't have to wait. It was just a long little walk to the place where I went, got in there. She told me, oh, you're going to get the Pfizer. I was like, oh, okay, cool. Then I didn't feel it go in. I said, oh, you're done? She's like, yes. Got up, went, sat my little 15 minutes. I was out within I think it was 45 minutes.
That's not bad. That's perfect. And I've got a little arm soreness. It feels like I'm back to my...
Somebody punch you?
Maybe punching. Maybe I threw 115 pitches, shutout baseball. Something like that maybe. But...
Oh, it wasn't the punch game.
No. But it feels fine. And I know both of you got the Pfizer vaccine. I got the Moderna. You can also get the Johnson & Johnson right now, which is 1 dose. And I know that there are a lot of locations in Houston that are doing that. But I think, it's really encouraging news, especially following about a week after the state of Texas said that they were opening up, mask required. A lot of the people that I've spoken with have said, even though the state's not mandating masks, my business, for example, is going to advise customers to wear masks. A lot of my friends, family, they're still going to wear masks. So that is encouraging that you've got a lot of people who are not listening to politicians and making informed decisions based on what healthcare professionals and scientists and doctors are communicating to the public. So I do think that's encouraging. But Hattie, Thomas, I think we're on, I knock on wood, I hope we're on the back end of this.
I think we are. I just wanted to say real quick is that while we have more vaccines available and opportunities for people to take them, there are still folks out there that are not clear, are still afraid, they're fearful of it. They're not getting, so I believe that there needs to be a better job of helping people understand the benefits of getting this vaccine. There's still work to be done there.
Absolutely.
And these are people, some of them are older, you have some are younger. They're afraid to get it.
My mom is one of them. So Mom, sorry I'm throwing you under the bus if you're watching this right now on LinkedIn or YouTube. But we had that conversation earlier this week. She's concerned about the vaccine and concerned that she could die from it. And that's concerning to me because I know that there are other people that have similar opinions, and she's not an anti-vaxxer or anything like that, but it's just it's concerning. And that's one of the challenges with COVID is you're developing a new technology, a completely new mRNA vaccine that has really never been done before, and trying to communicate its efficacy and safety to a large public.
And needing to do a better job of communicating the efficacy of it.
And I think the challenge is not necessarily, is there going to be side effects from a vaccine? Absolutely. It doesn't matter which vaccine you have, a sore arm, being sound asleep, or, being worn down for a couple days. I felt it after the flu. But there are people in this world that can't get the vaccine, whether it's influenza, COVID, measles, mumps, for whatever reason, not choice, but medical reason. And so as good stewards of society, it's our responsibility to try to do best.
Well, I think it's been really encouraging news, and I'm so glad that all three of us have at least the first dose of the vaccine. But if you have any questions on what the experience was like, or maybe how to register or sign up, drop a comment below, and we'll try to point you to the right resources. There's a lot of great people in Houston that can set you up. I think Facebook has a lot of groups available with, people kind of leading efforts to find people vaccines, which is just incredible. But on the positive end, a year after the country shuts down, there's light at the end of the tunnel. And that is something that we're thankful for. And we can't wait to get back and be more social in the community.
If anything positive comes out of this whole lockdown is all the people who don't want to use their vacation or their PTO, go into work when they're feeling a little down under the weather and they wound up with the flu or something else like that. And you're like, we know you weren't feeling good. Go home. So companies, be nice to your employees when they don't look and feel well. Truly, not playing, the sun's out, I'm going to play golf-itis. Or employees, please, help everybody stay well, not just with COVID, but just in general.
You've been listening to the Business Communicators.